All right, and the last announcement I will make before we begin the session is to remind everyone of our next session. The next session is entitled George Floyd, COVID-19 and America's Conscience. We actually planned this this session a few weeks ago, but current events have made it even more relevant than it already was, which was pretty relevant. So we're happy to have actually past MSTC president, Dr. Elliot Sorrell and Dr. Edwin Chapman speak on topics around the African-American experience, especially in relation to current political and health issues. So please join us next week for a very good conversation. So with that, I want to start by thanking our presenters today. We have with us today Dr. Catherine May, a past MSDC board chair and ANC commissioner. We have Dr. Angus Worthing, who is a past MSDC board member, advocate for healthcare issues, and the former chair of the Government Affairs Committee for the American College of Rheumatology. And we actually have members of Councilmember Cheh's staff with us today to give a staff perspective, and we're very delighted for them to be here. So I am going to let them introduce themselves, but I am going to start off with Dr. May. I'm going to ask her a question to get her presentation started, and we will go from there. So Dr. May, you've served as an MSDC board chair and an ANC commissioner. Can you share with us your advocacy lessons based on your experience as a volunteer leader, but also as an ANC commissioner?
Sure. Thank you for asking me to be here this evening, and I'm very happy to encourage people to become involved both in organized medicine and also in community affairs and in policy field. So I didn't go to medical school thinking that I would become involved in organized medicine or in politics. Things just kind of evolved that way. And as board chair of MSDC and past president of the Washington Psychiatric Society, I was involved in patient advocacy issues and also advocating for the profession. My role as an ANC commissioner and my relationship with the 2,000 constituents that I represented introduced me to advocacy of a different sort, although there were some similarities. You have to advocate, you have to know your constituents, you have to know your patients, and you have to advocate for best policies. And to that end, both roles brought me in contact with the Councilmember Cheh's Ward 3 staff. I actually became an ANC commissioner just about the time Councilmember Cheh became elected as Ward 3 council member. And it has been my privilege to work with her spectacular staff. So my advice in short would be to become involved and to not only know your constituents and know your patients, but also know your council members' staff.
Great, thank you, Dr. May. We'll dig into some more of your experiences, I guess, in the question and answer session. Dr. Worthing, for your introductory remarks, so as I mentioned prior, you've served on MSDC's board in the past. You've also chaired the Government Affairs Committee for the American College of Rheumatology. So you have the national advocacy experience and the local advocacy experience. Can you tell me a little bit about some of the similarities and differences, or I guess our attendees, can you tell them a little bit about the similarities and differences between the two different types of advocacy?
Sure, I think, and by the way, thanks, Robert, for inviting me on, and great to see some familiar faces here, including a fellow rheumatologist. We're kind of rare, so when there's a group of 7 or 8 and 2 are rheumatologists, it's like a takeover. The American College of Rheumatology has kind of cultivated relationships and a reputation for being nonpartisan and issue-based, partly because it's so small. Like I was saying, not too many of us in the country, like 6,000 out of maybe 1 million doctors. So So the college doesn't really sign on to very partisan bills, even though it might align with some of the policy initiatives, but rather picking out the specific issue that makes sense to rheumatologists. And when the college goes after and supports a bill, usually it's with a wide coalition. And if we're trying to get a bill introduced, it's definitely with one from each side, bipartisan right out of the gate. On the other hand, in DC, it struck me right away, I guess 5 years ago when I think it was Jonathan, I was bugging with Ed Schanbacker, Robert, your predecessor, about capping the out-of-pocket costs for my patients who have rheumatoid arthritis and were taking, and other autoimmune diseases, taking expensive drugs, which in the United States we call specialty drugs. Everybody was on board with that on the council. It seemed like a very reasonable policy solution to cap the amount that any individual would pay. So, and there wasn't like a need for bipartisanship at all to get something through the council. So that was immediately really different from Congress. What we needed was like this almost impossible consensus and lack of controversy. And I don't know if this is typical for DC Council or if it's just been my experience where the coalition of multiple patient groups and physician groups was told by the chair of the health committee, or excuse me, this was not on health, this was insurance and business. I'm forgetting the name of that committee. Where Vincent Orange, Councilmember Orange, said, the payers aren't really comfortable with this. Can you guys come to a consensus, and then we'll put it up for the markup and get it forwarded. That never happened. The American Health Insurance Plan Group, AHIP, never really supported this because it would obviously be extra regulation on their members. So long story short, it turns out, and this is one piece of advice to kind of stick to it in this 2-year city council period. We got in sort of the beginning of the period, or we had about a year to pass the bill. And before the bill expired, that chair ended up, I'm pretty sure, resigning or either being primaried and then resigning in kind of an ethical dilemma that he got himself into, which is probably Googleable, that cleared the way for us to get this bill through because a new chair came in, I think Councilmember Nadeau, briefly, and it passed, I think, unanimously, was signed into law. I'll never forget our first achievement. It was February 14th, Valentine's Day, 2017. It gets enacted or pseudo enacted, and then Congress didn't vacate it, so it became law. So people in the district don't have to pay more than $150 a month for their specialty drugs. So that was a little bit of national versus local politics and advice about sticking to it. And appreciate being able to follow Dr. May's advice here, getting to know your city council member staff, because I think my entire city council member staff is on this Zoom. So appreciate getting to know you guys again.
I wish I could have gotten them all here. No, there are actually 12 of us.
Okay, so we have
you have a plurality.
There you go.
Well, Jonathan, why don't I turn it over to you as the head honcho of the staff? Although you all as a team all work wonderfully together, and thank you all for being here on this webinar. I want to throw the question to Team Cheh. So from our perspective, we're the ones that are coming hat in hand with a request or an ask or an issue that is important. It's always important. But from you all's perspective, what are some of the things that we should know before we even come in and make an ask, before we bring this important issue to you? Like, what are the things that you would like people who walk into your office to know before they walk in?
I'm going to let Anthony answer that, but let me first introduce the staff who are on the call. I'm Jonathan Willingham. I'm Councilmember Cheh's Chief of Staff. Miss very much working with Dr. May as an ANC Commissioner. We wish she would come back. I'm also joined by Kelly Whittier, who is our Comms Director, and then Anthony Catalino, who is our Senior Legislative Counsel and who handles our health portfolio. And I'll let him offer his perspectives, and I might add some things at the end.
Sure. Thanks, Jonathan. I think the number one thing I would suggest to folks who are going to contact our office to pose legislation or some initiative that they'd like to see the council pursue is to do your homework. I think staff of council members are generally juggling anywhere between 10 to 20 different items at any one time, sometimes more. And the more that you can help the council staff understand the issue, understand what other jurisdictions have done, understand the ways in which this is going to help district residents, the better, because whatever you don't provide to the staff member has to then find that information themselves to provide it to the council member. And so that all just takes time. So to the extent that the work has been done beforehand, that's all the better in terms of getting things to move more quickly. Because unlike, I think, Congress, where there's a lot of things that are already built in, with council staff, we basically build the legislation from the ground up. I mean, we are the ones who are doing the drafting. We are the ones who are consulting with the general counsel's office to make sure that it's constitutional, legally sufficient. We are the ones drafting committee reports. We're the ones meeting with all the advocates, and that's often one person doing those things. And so to the extent that you can provide a draft piece of legislation, even if it's not in the council's, format or proper form, having something on paper is huge. Having done a little bit of just outside research about where this is done in other places is huge, because it allows the council staffer to then go to their member and pitch it with the sufficient background that the member is going to require in order to make an informed decision about whether or not she even wants to pursue it or introduce it. I can go on and on and on about best practices, but I feel like as far as the most basic thing that you could do in a first meeting, either with a member or with a staffer, that would be my recommendation.
And if I can just offer in addition to that, because Dr. Worthing made this point and it's a good one, the council it's 13 Democrats. There are technically 2 independents, but they're Democrats who changed their party affiliation to independent to run. So we don't have the typical partisan politics in play. And in some ways that means everyone is usually marching in the same direction, but in other ways it means that you have 13 different personalities, and it's sometimes hard to get consensus, which is what everyone really wants, right? And going back to your observations about Mr. Orange, no member wants to have to fight with anyone. So if you can get consensus, all the better. But sometimes that's just impossible. There's no insurance plan that's going to want to say, yes, please give us less money, right? And so finding what your what a member's tendencies will be, and to Anthony's point, one of the first questions that Councilmember Cheh always asks us is this done elsewhere? How does it work there? There are certain jurisdictions, right? If we go to her and say, yes, it's done in Alabama and Mississippi, it's going to be a different response than yes, it's done in New York and San Francisco. So having that background, knowing who your audience is going to be, and pitching it in a particular way is always very helpful. Keeping in mind that we don't have partisan politics, it's just going to be personalities.
Jonathan and Kelly and Anthony, do you also feel that it's important for the individual council members to hear from their constituents, their own constituents? Because I often found that working with other ANC commissioners who were in other ANCs run by other council members, and having their constituents write them letters in support of an issue was an extremely effective way of building as much of a consensus as you could.
I would say it certainly doesn't hurt. I mean, I think ultimately the policy tends to win out the day, but Dr. Worthing has, as a Ward 3 resident, has come to our office with sound policy proposals, and it doesn't hurt that he's a Ward 3 resident at all. And so the council members want to take care of their constituents and want to make sure that their constituents are being heard. So to the extent that a council member knows that there is support for something among her constituents is helpful.
And on that note, when or if you're able to take a meeting with a member, and we would sort of recommend that you don't flood a sort of an office meeting with many staff, but it would probably help if you had representation from that member's ward. It's sort of a nice icebreaker when a meeting starts, I find, and you can say, oh, I live over on Langley. And I think that can sort of set things off to a nice tone, but you definitely, even though we represent sort of the council's perspective in this discussion, we certainly can't undercut the importance of the ANC, especially for issues that might be more controversial, especially on one end of the city to another. I think having that sort of base level of sort of connection with your local ANC to make sure that if this was something that needed a bit more of a rally, a bit more of sort of like ground support, a lot of members are quite receptive to their ANC opinions.
Can I also I want to not exactly caveat what Kelly said. What Kelly said is absolutely right. But what a lot of people make a mistake and think that the only way that they're going to get anything done is by speaking to the member themselves and bringing a large cohort of people with them. I've been doing this for 12 years, and I can tell you that is not that is not what is always going to get things done. The best way to get something done quickly is almost always to meet with the staff first. Get them briefed, as Anthony said, come to them with something that's realized or realized enough where they can do the last bit of research that's necessary to take it to the council member in a form where she can do something with it. The more that people are willing to do that, the more I think you can move things quickly. And so that you can then have an actual conversation of where are things and who are going to be the obstacles and what are the arguments that need to be mustered. And being okay with that, I will tell you the best advocates before the council in general are the ones who know to go to the staff before the member.
Great, thank you for the feedback. I will say one observation when we talk about speaking with staff and visiting the offices. One thing the council has on that's equal to federal advocacy is space. And in some cases, the council office space is a lot better than the federal office space, especially if you're a new member of Congress. So I'll just throw that out there that it's actually very nice to come visit the council. I want to recognize that Dr. Desiree Pineda has joined us, the president of MSDC this year. And her entry into the discussion has brought to mind a question about hearings because she testified today on behalf of MSDC at the budget hearing. So I wanted to ask our participants from all perspectives to weigh in on how participating in a council hearing is part of advocating for an issue. And then, of course, from the staff perspective, how you all view people coming in and advocating at a hearing. So I'll start with Dr. Worthing because he's been quietest the longest, and then you all can everybody else can weigh in.
Well, yeah, I've done this twice, I guess, so that means I have triangulation of a couple experiences, but by no means an expert. And what struck me the last time we were up in the Wilson building talking about biosimilars, and Anthony, I think, was heavily involved. I'm not going to say you wrote it, but I think you wrote it, and I appreciate all the work that you did. I was totally surprised how bad the other ideas at the table were. I guess just honestly, the executive branch from pharmacy side had just an unworkable idea, and I was so glad to be there. That's the moment where you realize this is where I'm valuable. I can tell the leaders of our city that this person doesn't know how things work. I'm on the ground, front line with patients every day, and unless you devise a whole new distribution system or what, and unless you do something entirely different over here, that this idea is not going to work. So that was super helpful. And I think every doctor in the US has that sort of frontline experience of how the nuts and bolts work in patient care and in their, at least in their microcosm, their system, hospital, group, et cetera. So that was really helpful. And then secondly, like just getting to the table, being part of an organization like MSDC, the first time I did this and the second time I did this, you get a whole lot of support for with materials that the organization has and advice, who's who, so that you're sort of oriented at the table, because it can be kind of intimidating when there's a bunch of people in the room, or when there's nobody in the room and there's only a couple people and you don't know who they are. So that's really helpful to have the organization saying, that's the member and that's his lawyer, or, these are the personalities and what they're talking about. So that was really eye-opening for me to be at the witness stand.
Yeah, and I would add to that I learned very quickly that one must be both concise and clear. Whatever you have to say needs to be said in the first paragraph and can then be embellished and supported and resources appended. But you need to make your point within that first, really 1 to 1.5 minutes.
From the council side, I would say, the hearings are incredibly important, if only for the fact that we are establishing a legislative record. Most members are not attending the hearing. I think it's probably overwhelmingly the case that you will have a hearing in which the chair of the committee is there. Maybe one other committee member will be there if they're the one who introduced it, but even then, not always. And then you'll have staff sort of coming in and out. And so when a bill moves forward and there's a committee report, that committee report summarizes all of the testimony that was either submitted in writing or submitted at the hearing. And that is often most members and their staff's opportunity to know what the public thinks about this bill, because they were not physically present and they're not generally going to go back and watch it, the recording of it. And so if you don't show up in that way, you tend to disadvantage yourself because your voice is not captured in that very, very concrete way. Now, I also say that is not, I think that's sort of a necessary component, but it's not sufficient in terms of, there's also a lot of behind the scenes meetings that are happening. And I think that's where actually most of the real work gets done. I do think the hearing can be a little bit of theater and a little bit of performance. And so there's value to both of those, aspects, both the sort of in-person meetings outside of the traditional hearing process, as well as the formal hearing.
And just to piggyback on that, our hearings are different from, say, a congressional hearing, right? A congressional hearing is almost exclusively theater, with only witnesses who are invited, with statements that everyone knows are coming. Anthony is quite right that the meetings that happen outside of the hearing process are where a lot of the work happens. And then once you decide how it's going to go forward, the hearing can help establish the predicate. And our hearings are open to the public, and we do want to see just generally how do people feel about things, and that will help mold things that ultimately become part of the report that is critical should a piece of legislation end up in litigation, or if the agency needs to understand what is it that you were trying to accomplish here. That's what's all embodied in the report, and it's a little different than on the federal side, where I think the work is exclusively done in the other meetings, and the hearings are grandstanding. No offense to anyone who goes to federal hearings.
As someone who's put a witness up in a federal hearing, it's very true. Although you never know what a witness is going to say, so you always have that of concern from the private sector end. And I will compliment the council staff, because if you have not had a chance to look at hearing records, it is not an easy undertaking. So there is a lot of work that goes into it. So I want to specifically ask Dr. May a question, and I will note it is about 6:30, so I'm going to do my reminder for questions. Please enter them into the chat box if you have any, or email me. But Dr. May, I had a question for you from your perspective as an ANC commissioner. Can you talk a little bit about that role and how you navigated, constituent concerns versus, your own medical perspective, and because when you're serving as a commissioner, there's a lot of different aspects at play that aren't there if you're just a practitioner who's advocating on issues or something like that. Can you talk a little bit how you balance
Sure.
different I don't know how you want to call it, but different perspectives as a commissioner?
Sure. So for those who don't know, an ANC commissioner is an advisory neighborhood commissioner. It's actually the lowest life form in the DC government. It's an elected but unpaid position, and you represent 2,000 constituents. And actually, technically, there's very little overlap between advocacy work for patient groups and organized medicine and advocacy for exceptions to historic preservation laws and no left turns on street corners. But there is some overlap, okay? And especially in the public health realm, because, for example, DC government, I understand, recently decreased the speed limit in the district from 25 to 20 miles an hour. And that has been a 20-year process of residents saying that the traffic is moving too quickly, the streets are unsafe for pedestrians, and this has been a great response, and it certainly is a public health intervention. So when you're an ANC commissioner, I actually did not use Dr. May, I just used my regular name, and I did not advocate specifically for health-related issues in ANC meetings. It really is, all politics is local, and ANCs are very local. It happens intersection by intersection, and on the rare occasion, there are citywide issues. One issue that I think where we were helpful as a profession, and I'll go back a couple of years here, was the whole issue about the changing the street lights to LED lights. And there was a big concern about how many Kelvin and whether it was going to be soft yellow light versus strong blue light. And I was able to get Louis Krause to come and give testimony about the adverse health effects of blue light and the higher Kelvin. And so that was an area where there was a very, I think, beneficial effect from my being a physician as well as an ANC commissioner. Where I would advocate physicians to become involved on a local level is really you get to serve as an ambassador to members of the community, that they get to know you not in your office, not as a professional, but as a fellow citizen. And I found that extremely helpful and extremely effective, and built up a large connected network of people in various professions that I was able to draw on, legal, economy, architects. And actually some of the architects were very helpful in the streetlight issue. So there's both separation, but also some overlap.
Great, thank you. Great, valuable perspective, no doubt. So I've been receiving a couple of questions about the current advocacy situation, witnessed by the fact that we are all in different locations. So I want to ask a couple of questions about the new normal in advocacy. First up, and this is from Dr. Pineda, the testimony for hearings and pretty much every meeting is now being done via Zoom or video conference, WebEx. and I'll throw this out to Jonathan, Kelly, and Anthony, if any of you all have any tips or thoughts as to how to have an effective meeting with someone via video conference, or to be effective in a hearing by a video conference, keeping in mind that this has only been a month or 2 month experiment, so we won't hold you to your answer.
I'll say I've actually had some of the most and some of the least effective meetings over the last 2 months. Doing it telephonically or via WebEx or whatever forces a certain distillation of the points, which I think is really, really helpful in terms of meetings. In terms of hearings, there have been kind of a couple of different tacks that I've seen people take. Our committee didn't do any remote testimony like this. We encouraged everyone to submit written testimony, which ultimately, if you think about the purpose of the hearing, which is to create the hearing record, that's usually better. The in-person testimony often is constituents who have a particular issue with a particular agency. We haven't yet, though, I should point out, we haven't yet had any remote hearings on bills. We've only had remote hearings on oversight. So that is going to be a different beast, and I don't yet know what that will look like. And I hope that we will soon see what that looks like, but the chairman has been very hesitant to do that. But forcing people to really, because you can't have the same kind of elongated banter that you would have all sitting in a room together for 45 minutes. Forcing people to really crystallize what it is they're looking for, and forcing us as staff certainly to figure out, okay, what is the absolute critical information that I need to get out of this meeting so that I can then move the ball to the next step, has been interesting and helpful. So I think, just as Dr. May said earlier, getting everything really crystallized ahead of time would be incredibly helpful. I don't know if Anthony or Kelly have different perspectives.
I have a sort of another piece to add specifically for hearings, in that not only are you testifying to add to the hearing record, but there's also a utility for the media and also sort of the staffers in my position, especially if this is something that's maybe controversial, or if I want to try to gin up some press coverage of it to help sort of move the dial and where either public opinion is or the other members. And it's always great to think in sort of when you're presenting your testimony in sort of these, to be thorough, but also provide sort of crisp sound bites that we might be able to use, as well as the media might be able to use later. They're always watching, we're always recorded. And if there's anything that, say, I as a staffer could use to sort of amplify an excellent point and sort of the direct perspective of someone who we're working with, it's so helpful, because then it's just not the member constantly advocating for this. It's showing there's a swath of support. And there have been plenty of instances in person where media you'll see will set up in the back of the council and they'll reuse that footage. So not only in sort of being crisp in what you're saying and getting, like Dr. May said, the chunk of that really meaty information out at the forefront, but also sort of thinking of what are the crisp, clear, spicy things that I can say that will get the whole point across now and will also demonstrate how important this is. Because a lot of this is working on priorities, even though we are sort of all representative inherently of, progressive and democratically minded members, there's also a chain of priority in what the council will choose to address. And I'm sure that will be especially emphasized now that we might be transitioning into, new types of hearings over these sort of electronic means instead of in person.
And that brings up another question that I received, and I'm going to kind of broaden it a little bit from that last question. We've seen in the past few months some really good examples of issues changing on the fly. So just this past week, we've seen, the discussion around policing change rather quickly, or at least how it's framed change rather quickly. Seen this past week but even in what we'll say is a normal advocacy period, outside forces can change how an advocacy or how an issue is considered. It might be, something outside of our control, or a news story or something like that. So I will start with the physician presenters, and Dr. Worthing or Dr. May can fight over this one. And if you could talk about maybe some of the advocacy you've done or an issue that you've worked on where there's something that has changed or reframed the issue and how you've approached it from an advocacy perspective. And then from our friends from the council member's office, if you all have been working on an issue of priority and then something has come that's changed how it's framed or considered, I'd love to hear how you all handle that kind of situation. So I know it's a very broad question, but hopefully that'll lead to some useful answers.
That's a great question. Well, I think with the pandemic a couple months ago, the relative importance of regulation about how we use the electronic record, obviously using telemedicine became a huge priority, and how we get paid by Medicare and other insurance and like commercial insurance payers really started to matter for telemedicine. And then since 20% of people don't have a video camera or can't get it to work, phone calls became much more important, and paying for a phone call, which was never done, started getting done at the level of an office visit or a telemedicine visit. So I think that obviously changed the priority of all the doctors in the country, flipping the switch in like 1 week on telemedicine to number one, from maybe a very, very low boil, if anything, on everybody's radar screen. And luckily, a lot of things that had been going on, regulation about quality measures, a very kind of nerdy technical point called sequestration that was reducing people's ability to do kind of pass through ancillary services like giving medications in the clinic, evaporated. They went away in legislation really quickly after years of fighting for it. So that's maybe one way how current events changed the way doctors advocated, I think.
From the council perspective, oh, go ahead, Dr. May.
No, I was going to say there has been some overlap in patient advocacy and professional advocacy. I think just picking up on something Dr. Worthing said, you know, some of my patients have made calls from their bathrooms because that's their only private place in their home. And so the whole issue of access to care and what happens once the licensing exclusions are lifted after the pandemic, and will you be able to continue seeing your patient who is now sheltering in home in Florida? Those are patient care issues that are also become professional issues, and I think MSDC will have a role to play in advocating for that expanded care.
Well, one thing that came to mind from the council perspective, and this is not a health-related matter, but a few years ago, Councilmember Cheh had introduced a bill to eliminate the statute of limitations on essentially felony sexual assault and sexual abuse cases. DC, like a number of states, had put a limit of generally around 10 or 15 years statute of limitations, depending on the severity of the offense. And that legislation, I think, had to be reintroduced at least one time, and had really not moved. Obviously an important issue, but was not generally high on the judiciary priority list at that time. Well, then Me Too movement happened. And suddenly everyone was looking at statute of limitations. And it just so happened we had a bill that had been sort of just sitting on the shelf waiting to move. And that's sort of how, and one of the things that's important about this is, for me, it's not just about the fact that something is in the headlines and now everyone wants to move on it. It's that public consciousness coalesces around the importance of these things. People suddenly began to understand why statute of limitations in these cases can be so damaging, because we came to the realization that people, survivors, hold back this information often for decades. it's not always about repressed memories. It's about shame. It's about stigma. It's about fighting people who are in positions of power. And those things I think were maybe apparent to people, but when it came to a head in the media, I think there was just sort of a national awakening about how these things function. And then the policy was easy. And we were able to move that legislation very, very quickly.
Great, thank you. All good perspectives. I'm going to be selfish for a minute and ask a somewhat selfish question for the group. I'd like for you all to talk about how organizations and either a society like MSDC or a union or some sort of organized group, what role they play in advocacy, because we've been talking a lot about individuals. So what role does an organization play in advocacy for an issue? I'm going to start with Dr. May, since you mentioned not only MSDC but APA, if that's all right. Can you start us off and talk about how organizations can play a role in advocacy or support you in your advocacy efforts?
Sure. Because our primary job is to see patients and deliver health care. So it's extremely difficult to take time away from your office to go down to the council offices or go to Capitol Hill. It's difficult to take the time to research. And when I was president of the Washington Psychiatric Society, I was fond of saying to the members, for the price of your membership, that buys you, 1 hour of a lawyer's time, but it buys you countless hours of advocacy on the part of the organization for both your patients and your profession, because your professional organization can be down at the council building and can do some of the legwork to make your voice heard. So that's the short, concise, and clear answer to your question. One thing MSDC could do, because this is an issue that affects both patients and physicians, is the whole issue of prior authorizations and patients who go off a medication that they've been on because they changed their insurance plan and the new insurance company is requiring another prior authorization and there's a delay in time. And this is a complex issue, and there are multiple arguments on all sides, but it's something that affects our patients on a day-to-day basis, not to mention adding to the administrative burden of physicians. So that's an issue that I would see coming down the road.
And then I'll turn it over to Kelly, Jonathan, and Anthony. And you all obviously deal with a lot of different organizations and unions and organized groups. What's the best way that individuals can work with their groups to meet you all's goals, especially, going back to Anthony's point earlier of doing your homework and coming in with hard information to make you all's lives easier?
Yeah, I think that the best way that organizations bring a lot of expertise, right? And one of the things that drives, as I think Anthony mentioned earlier, drives most of the decisions that Councilmember Cheh makes are policy-based, not politically based. And I think that's probably true of most of the council members. Those should be rooted in expertise, in what other jurisdictions are doing. Obviously, in a legal perspective, we can, as staffers, do a lot of that. But what organizations bring is that expertise that we need to know how, and I think you said this earlier, how is this working on the ground, right? What are frontline people seeing? How is a proposal that might make a lot of sense to us with our pointy-headed legal ideas, how is that actually going to be implemented? And I will tell you that the other side, in whatever issue it is going to be bringing their own expertise. And oftentimes what ends up happening is not dissimilar from what happens in litigation, where you have kind of a battle of the experts. So the more of that you can bring to the table, the better armed we are to advance a particular policy goal.
Great. And Dr. Worthing, I will compliment you on when we were talking about hearings, you did not bring up the fact when you were talking about staff being there to assist you that the last time you testified at a hearing, Staff was not there because staff was on their way to an AMA meeting. So thank you for not calling me out on that issue.
Well, you had Pia there, and she was really helpful.
That's true.
No comment.
Very good. All right, so I'm going to do last call for questions because I have one to end the session with, but another one. I want to follow up with something Kelly said, if that's all right, and of course, Jonathan and Anthony weigh in on this. Kelly, you mentioned at the hearings, sometimes comments can be good to drive press or attention to an issue. I'd love for you to comment for a minute or two on, or as much time as you want, on how communications works with advocacy. Because I think sometimes we think of advocacy as I'm going in and I'm going to talk about how important this issue is, but there's also this other aspect of how the members' priorities are communicated. So can you talk a little bit about how, you know, comms and maybe some more issue-based advocacy work together?
Oh, certainly. So I would just say that while most members will want to move and advance legislation because it's the right thing to do, the arguments are there. Having favorable press and the notion that you can then be displayed as, you know, a champion for your residents or for a particular issue area is also very helpful. It's also invaluable when you have these very sort of nuanced pieces of legislation in front of you to be able to communicate them broadly. And while you might have, like on a very small issue area, a very narrow subset of what legislation will do, the press should be used as a tool and an opportunity to, one, make sure that whatever your issue is or policy change that is happening will actually reach the majority of the folks it's intended to change. One of the sort of more frustrating or sad pieces is when you work so hard to get something through and then people don't know that it's happened. I was on a call earlier today with a young girls coalition, and they hadn't really realized that there were food resources available through local groceries that the district has organized, for just sort of free grab and go meals. And the fact that these young girls and their families weren't aware of something that had been out in the community for almost 2 months is a disappointment and not really the goal that we wanted when we intended to launch it. So I would say that you not only have the press should be viewed as a tool, not only for the pressure for members who might not be amenable to the legislation or the advocacy piece that you're hoping to push, as well as to reassure those members who might be supportive or might be on the fence that this is a safe space to do this. There are, and as well as whenever you come forward with these things, it always can help from our perspective. A reporter will always ask me, is there a patient or someone who I can speak to directly about this? So they can have the advocacy from an organization, from a specific provider, but ultimately the press would love to speak to the patient or the person that's being affected. Councilmember Cheh was the lead on the Death with Dignity legislation. It was certainly a really heavy and multi-year lift from her perspective. But what really helped us, make the case not only to sort of the public at large, but also the other members who were on the fence of that policy decision, and perhaps that you could also say that medical decision, were patients who came forward who said, this will affect me and this is why it's important to me. So I think in terms of the press, they should absolutely be used as a tool. And especially when you have a member who's on board with whatever your initiative is and they're leading the charge for you, speak to their communication staff and say like, hey, I'm available to speak to the press. I have patients who may be also interested, and sort of be that vehicle to get the story actually published.
Great, thank you. It's certainly we cannot forget the press element of any of our issues that we bring up. So I would like to end on a high note to inspire those who are listening to us tonight and henceforth, that they can make a difference in the world. I'd like each one of our presenters to talk about or mention their proudest advocacy moment. So this could be either an issue that you worked on that passed or was defeated, or a hearing or a meeting that you had that you felt really made a difference, that you were most proud of. So your proudest advocacy moment. I'm going to start with the physicians because they're on my screen, and then we're going to go to Jonathan, Kelly, and Anthony, and you all can talk about, potentially issues that you've worked on. But Dr. Worthing, I'll start with you on my left on my screen. Give me your proudest advocacy moment.
Thanks. Well, I talked about how Councilmember Cheh and the staff here on the call helped the Specialty Drug Copayment Limitation Act get through. So I've already got one. So I'll say the other, which is that like 2.5 years ago, some may remember that an idea was floated in Medicare to pay all doctors equally for an office visit, no matter if, as the New York Times article said, like sniffles or cancer, they're all going to get paid the same. And so the people on the end of the spectrum that, like rheumatologists in my group, and I was the head of the advocacy for rheumatologists in the country at the time, we were going to receive on average less reimbursement for the complex care that we did compared to people who would take care of patients who have relatively simple problems, because the average was going to be used to pay people. So a New York Times reporter, Robert Peer, came to the American College of Rheumatology and asked to speak to a doctor. So since I was at the tip of that spear, I got to be in the New York Times and send a copy of a color photograph of myself to my mother, who grew up in New York, so that was extra special. And not just the press, but it actually mattered. So the CMS went back to the drawing board, came up with a different formula, dropped that idea, and came up with, lo and behold, a plan that boosted rheumatologists' income by 15%, which hopefully will go into effect if anybody has any eyes and ears in CMS or in Congress January 1st. We hope that this plan goes into effect. And it hopefully, I would think, not just from a rheumatologist perspective, but patient care was going to suffer on sort of a one-size-fits-all type of plan. So I think this ends up being a lot better. That was my proudest moment, I think.
Dr. May, what do you have to say?
So Robert, I was raised to think that pride was one of the 7 deadly sins. So I'm going to just back off here a little bit to say it's really difficult because, and so I'm not going to name one thing. I'm going to say, I think what I am most proud of was taking each patient and each constituent's issue extremely seriously so that they felt heard and that they felt they had someone who could help them navigate the system, advocate for them, make sure their voice was heard. And none of these were necessarily big policy issues, but they were very important to the individual person. And so that's what I am most proud of, is that across the years, that is what I have always focused on. And there were many, 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 many issues and no left turn signs, yes.
Great, and I'll turn it over to our friends from Councilmember Cheh's office.
You know, having worked for someone like Councilmember Cheh for 12 years, I thankfully can say that I have a whole lot of moments that have made me proud. It's really remarkable to be able to work for someone who is driven by good policy and is intrigued by the quirks of the law and fixing them. I will say that from a personal perspective, for me, there are 2 that are up there. One is a few years ago, there was a huge fight in the council between the council and the mayor about where to put short-term family housing shelters throughout the city. And what was remarkable about that fight is that we were fighting about where to put them, not if we were going to put them, not if we were going to build. No other jurisdiction in the country is building new shelters. People are trying to shut these things down because they don't want to pay for them. And that wasn't even remotely the argument. It was about how many are we going to build and where are we going to build them. But on a very personal level, cast your memory back to the fact that gay marriage did not used to be a federally secured right, but was done at the state level. And DC, I got to actually work on the legislation that secured that for us, and it passed like 12 to 0 to 1 abstention. But that was really something. But I think we all have things that made us proud. Anthony?
Yeah, I mean, I've been at the council for 8 years, and I have a number of proud moments, but I actually want to highlight just what happened yesterday. I haven't seen anything in my 8 years in the council like what cities and states and the federal government across the country are going through right now. And the emergency policing and criminal justice reform bill that the council passed yesterday in very, very short order with very, very substantial protections. It really is my proudest moment. I have no idea what's going to happen. None of us do over the next many, many months. But what I saw were colleagues that were not debating whether we should do something, but how far we're going to go with the things that we're going to do, and taking this very, very seriously and responding to the moment in a way that it deserves to be responded to. And just as a staffer for a member at this council, I was very, very proud of the body and feel very, very privileged in this moment to be working.
Oh, you just muted yourself. You're muted.
How about now?
There you go.
Only 2 months of Zoom meetings and I'm still muting myself. That's so beautifully put, Anthony. I agree with so much of that. Yeah, we're very, I've been with the council since 2013. So there are many moments. Certainly the most technically ambitious legislation that I've been a part of on the staff level has been the previously mentioned death with dignity legislation. But my favorite moment is just a very, very small thing. A couple years ago, we had some young men who were, I believe, either lab school or some other sort of specialty school students, and they were previously playing for football on the Wilson High School team. And because they weren't public school students, when it was determined that they were ineligible, they decided to lobby the council to sort of create a very tiny exemption for them for that, so they could finish out the season. And going into the legislative meeting, every member had come out publicly to say that they would not be supportive of the legislation. And those two boys sat at the front of the sort of audience with their helmets in their laps. And they sat through, gosh, it must have been like a 4 or 5 hour legislative meeting that day. And by the end, just one by one, when we got to that one measure that would allow them to finish out their season, member after member was saying like their dedication and their time and their fingers being crossed for hours moved them to, support that bill. And it was a very small moment, but one that was also sort of very beautiful in that, we do these very grandiose, systematic things all the time, but there's still opportunities to change like that individual life. And for those boys, like especially sort of being able to join their public school peers, seeing how important it was to them, it was just like such a triumph. It was a small moment, but one that is the first thing that comes to mind. Is beautiful and, makes you really happy to be able to do that for folks.
Incredible all around. That's awesome. Thank you all very much for sharing your personal thoughts on that question. Well, I want to thank, I'll start with the people who didn't have to be here, and Jonathan, Kelly, Anthony, thank you all very much for coming on and giving a very valuable perspective and stories. Thank you, Dr. May, Dr. Worthing, for being here tonight and for your years of dedication to medicine. And thank you to everybody who joined us tonight and asked questions and participated. So it's been incredibly valuable. And so everyone be safe, be healthy, and please join us next week for our session. And I apologize, I have to look at the title again because it was recently updated. Our session next week, George Floyd, COVID-19, and America's Conscience. That's going to be a very powerful discussion. And keep an eye on our Wednesday schedule. We've got some great sessions coming up, including actually one with Dr. Wayne Frederick from Howard University in 3 weeks. So keep an eye on your email. And thank you all for participating. Greatly appreciate it.
Thank you for having us.